6 months ago, I found a lump in my breast. I'd always been very aware of checking it. I immediately started thinking worst case scenario. It was very, very stressful. But my GP referred me to Mr. Dimitri Hadjiminas at the Harley Street Clinic Diagnostic Center. The facilities are excellent, and the breast care nurse was there for me whenever I had any questions and to help me through the whole process.
The Harley Street Clinic Diagnostic Center provides us the facilities to run a one-stop diagnostic service for patients with breast problems. Helen came to see me referred by a general practitioner with a lump in the right breast. I initially examined her and thought that this was likely to be a tumor. I organized a mammogram and an ultrasound scan. A mammogram is an X-ray of the breast, whereas an ultrasound is very similar to the scan women have during their pregnancies. Usually, these two tests are sufficient to make a diagnosis of a breast lump. But in Helen's case, her breasts were very dense. In these breasts, sometimes mammography is not very good at determining the size of the tumor, and an MRI scan is better. We managed to do all three of these radiological investigations during the same afternoon. One of the very few places in London where you can have that done on the day. The breast care nurses are the key worker that the patient will have, if you like, the first point of contact. They're also the link between the different specialties. They will communicate with the various medical disciplines.
Well, once we had established that it was cancer and we were able to make a plan, I actually felt a lot calmer about the whole thing.
It became obvious that we were not going to be able to preserve any of Helen's right breast because the tumor was just over 4 centimeters in diameter.
I needed a mastectomy, so breast reconstruction was brought into the conversation. And Dimitri introduced me to Stuart, who then was able to sort of expand and put all of my options on the table.
So when I first met Helen, she explained that Dimitri had recommended a mastectomy and she was keen on immediate reconstruction. We talked our way through the reconstructive options, both those using an implant and also those using her own tissues, which we refer to as autologous reconstructions. Undertaking immediate reconstruction, you've got the opportunity to preserve the skin over the breast and minimise the visible scarring. We selected a DIEP flat reconstruction using the lower abdominal wall tissues to reconstruct the breast. The important thing I emphasise is that patient choice is at the forefront of all the decision-making process. And some patients will hear what's involved and decide that they don't want a reconstruction at all, whereas others will want to follow it through until they get the best possible result. The operation itself went very smoothly. She made an uncomplicated recovery and was discharged home about 4 days after the surgery.
Obviously, massive relief that the cancer's out. The reconstruction looks great, it feels great. Yeah, the diagnostic center was fantastic. I mean, the team was amazing, very supportive. The breast care nurse was there the entire time, answering all the questions that I had. And the time that I was actually able to spend with Dimitri and Stuart was incredible and very personal, very caring. So I feel like I'm back.